Hi, my name is Stephanie Mishler. The evidence-based instructional strategy I chose was the Picture Exchange Communication System, also known as PECS. PECS is used with children and adults with little or no ability to communicate. PECS is often used with adults and children who have autism. People who use PECS learn how to initiate conversation, communicate requests, and communicate a thought using a picture card. There are 6 phases of the picture exchange communication system. They include how to communicate, distance and persistence, picture discrimination, sentence structure, answering questions, and commenting. The article that I reviewed was called Long-Term Effects of PECS on Social Communication Skills of Children with Autism Spectrum Disorders, a follow-up study. The study assessed social communication skills in nonverbal preschool children with autism. The study tested the long-term effects of PECS after 12 months from completing the treatment. 2 groups of students were assessed. 1 group of children had completed the conventional language therapy, and the other group of children completed the PECS training. Both groups of children were assessed using the same assessments after they completed all their training over the course of 1 year. The children selected for the study had to have a clinical diagnosis of autism. They had to be between the ages of 18 to 60 months of age and have little or no functional language. Prior to this study, the children could not have used PECS or any alternative augmentative communication system. During the study, the children completed 30 minutes of individual therapy sessions, learning either the PECS or the conventional language therapy 3 times a week. The results of the study showed that the children who received PECS training demonstrated a significant improvement in communication and social skills compared to the group of children who received the language therapy. Children who received PECS demonstrated specific improvements during free play activities by increasing their frequency of joint attention, initiation, and the duration they were able to play cooperatively. According to the findings from the article, long-term effects of PECS on social communication skills of children with autism, PECS training can enhance communication skills in children with autism. The author's study was conducted by parent reports and examiner-led measures. The authors recommended if they were to complete another study, they would take into account measures that occur in a child's everyday environment. They also discussed in the article if they were to complete a future study, they would assess how each of the 6 phases of PECS training affects specific social communication skills. They didn't go into great detail about how each of the 6 phases were implemented, so that was something else that I would also like to know more about. The outcomes from the study used standardized assessments to measure the children's social communication ability. The assessments that they used were the Griffiths Mental Developmental Scales, Autism Diagnostic Observation Scale, and Vinland Adaptive Behavior Scale 2nd edition. Observations were also used during unstructured free play sessions for monitoring progress. The study received a reliability score of 0.85. From this article, I learned that PECS does have a positive effects on children's social communication skills, specifically in the areas of joint attention, initiation, and cooperative play. All these skills are needed to develop speech. I would use this instructional strategy while working with students with autism because it has proven to help children improve their communication skills based on the results. Social communication skills are vital skills for young children to learn. Without using an effective intervention such as PECS, children may internalize or externalize problematic behaviors. A few questions I have regarding the article, Long-Term Effects of PECS on Social Communication Skills of Children with Autism, a follow-up study. I would like to know more, like I said, about implementing each of the 6 phases of PECS. And I would also like to know more about the long-term effects of PECS on children who used it for a longer duration than just 1 year. So children who used it for 2 or 3 years, and comparing the 2 groups of children that either used the PECS training or the conventional language therapy. Thank you for watching my video.